Agad the Cahirli agus Falchum Revan mBille Shaw is mBille Jarfache an mBille Sláinte Ilghnéitheacha fihe cahar agus go háirithe mBille ag ddíriú is deathar gárad fáil ré leis an tostal muoine ó híh seomra chur cís agus maidir le tuile cuachtaí a chóit do potagéirí na tíre agus is machchan rud é sin. Agus mo bhuichas a rís don leirlinn as ocht an iris ólis a churn siad fáil agus a chur siad fáil a rís an simúl agus gatrod curthaí cóigs, so gur mille maithagad don lauren. I'm not going to repeat what I just said in Irish, so thank you, Minister. I welcome this bill. It's short and it's to the point, and it's to there'll be no means testing in relation to the medical card, which is very welcome for those who want to rent out a room. I'm going to come back to some of that in a minute, and although we're not talking about a housing crisis, I'm going to bring it in because it's brought in the digest to give context to why this is so important, renting a room, to make it as accessible as possible for people to avail of that scheme and not be penalised. So that's very welcome. It's also welcome that we're extending the powers of pharmacists based on recommendations of a task force. Although I should say I'm not sure about the regulation of that, or who's going to oversee that. I mean, like any of us, we run to the chemist and we beg them to renew a prescription and put pressure on them to renew, and it's something we want, but we want it under supervision. We want to ensure, I think particularly of mental health, I think of all actually prescriptions, particularly mental health, and prescriptions renewed without proper supervision or monitoring. So I know there's a review promised. I didn't see it in the legislation. Maybe I missed it. I'm not sure if it's listed in the legislation or whether it's something that's going to happen automatically. Yeah. So I worry about that because just earlier today, I don't know if you heard, but I raised the bill that was brought in, the Act in 2017 to protect sex workers, ostensibly to protect them. And written into that bill was a review to take place after 3 years. That hasn't happened now, and we're in 2024. And that's where the review was written into the bill. So I'm very worried about I know it's come from the pharmacists, I know it's come from the task force. There was an interim report and a final report and ongoing suggestions. And I think the next step that you're looking at is that the pharmacists would be able to prescribe for minor injuries, which doesn't happen. Now, I'm open to any of that as long as there's openness and accountability and monitoring. I have a little concern about an example that was given here of the extension of the administration of vaccines as well, that would extend to other therapists, the extension given the power to administer a vaccine. That probably will be done by regulation, will it, at some stage? I don't know, but the example given here was that it would be physiotherapists or occupational therapists, one of those. I'd have certain concerns about that, a podiatrist. So you might just, if you have the chance, I'll be running back into the chair, so I won't, but I'll hear your reply. So just in relation to that. So I welcome all of that. Actually, the list given here, such as vaccines, dentists, nurses, midwives, opticians, physiotherapists, podiatrists, radiographers, and pre-emergency care. Some I have no problem with, some I would have a little concerned about. And then there's provision also for alternative medicines, extending that, which some of that is there, but it'll be extended. And I've no problem with any of that. In relation to the making it easier for people to rent out a room is good news, and really it has been underused. And actually all of us are remiss in not asking questions about this rent a room scheme, because we haven't really held this scheme to account or how it has been operating. And in fact, the question I could find, and it was Deputy Bruton who put in the question in relation to it, and he came back, the answer came back, and that's in October 23, and it goes through the amount of households renting a room from 2016 to 21. So it started off at 7,350, and they're called taxpayer units. And it has increased to 10,730 in 2021. And it gives the cost of that to the state then, the highest cost. It's increasing all the time, but the cost is 26.8 million in the cost of those taxpayers' units at 10,730. So clearly there's a need for a cost analysis here in relation to this. This is revenue foregone. I'm all for the rent-a-room, but I would like to see figures and an analysis and a breakdown. And then it's allowed up to 14,000, which is very welcome. But my concern around that then is that we're setting a ceiling to which households might aspire to take in. And so it seems off the deep end to talk about 14,000 for a room, and I'm sure that's not what's happening. But again, I'd love facts on that. Now, that's outside of your area, but it comes into what we're changing the law for, which is good, without really the information to hand in relation to the breakdown of the rent-a-room scheme throughout the country. Who's availing of it? Are there a number of rooms being let, and are they taken into account up to the 14,000? That's my understanding of it, that you could rent 2 or 3 rooms and the money will not be taken into account as long as it doesn't exceed 14,000. Interestingly enough, if it exceeds 14,000, then you are taxed on everything. But again, I would just love to see a breakdown of that. And on that, again, I'm a little bit unsure as to whether those in local authority houses can now rent out a room and that's not taken into account for the rent assessment. I think that was being done and by the Minister for Housing. Again, I'm not sure. I take some of the blame myself for that, and with colleagues, we should be asking questions regularly, find this out. But sometimes it's difficult to keep asking questions and then put it together. In relation to the other aspects of housing, the average weekly rent, and these are stark figures, the average weekly rent in private rental accommodation increased by 37% between 2016 and 22. Again, I'm not going to go into the details, but the figure, 37% increase. And when we go on then, what's available for renting, and there seems to be, again, I leave this for a housing debate, but I'm just highlighting the number of tenancies. So the Residential Tenancies Board give a figure of 246,453 tenancies registered. And the CSO give a different figure, and so on. And what is suggested that it accounts for that distinction is that some people are saying they're renting, but they're actually in student accommodation and in other types of accommodation that's not registered. But following from that argument, then, we have a very interesting comment by Dr. Michael Byrne, Associate Professor, Department of Social Policy, UCD. He has more names in his title, but he suggested to the Joint Oireachtas Committee that rather than it being a case of landlords leaving the sector, which is often said here that they're leaving in droves, his comment and his observation was, rather than leaving the sector, it may be that they are fleeing regulation, which is a very interesting comment, and we're waiting to see from the CSO. They're committed to doing a 6-month investigation as to the difference, a significant difference between the tenancies registered and other tenancies. So that was interesting arising from that. And then again, student accommodation, and mostly it'll be students that will be availing of the digs, of the rent-a-room. And again, the significant, there's almost 200,000 students in Ireland. To be precise, I'm being told 199,000 students. And it's expected to grow to 239. But again, 19% are in digs. And in digs, 19%, which is huge. And I know that, again, it's not specific to students, but it will be students availing of this quite a lot of the time. And in addition to that, there is specific student accommodation. And what's been pointed out, and indeed with research from Galway. So why I'm saying of this, no matter what we do with measures, the consequences, we're keeping the prices of rent high all of the time. So every initiative that we're doing, and I'm welcoming this initiative, but it's also keeping the prices extraordinarily high and almost setting a ceiling to which we now aspire to. And the research from Galway, the affordability of student accommodation has been highlighted repeatedly as an issue for students. And their NUI study said one of the most controversial aspects, and this is significant and relevant for Deputy Minister Harris, one of the most controversial aspects of purposefully built student accommodation is the level of rents charged. And so the rents are getting higher, even though it's purposefully built. And it's something else that I'm interested in. We're providing a huge amount of public money, which is good, except I don't know what the guarantee is for the state on it. Are we funding entities, whether they be university entities or other, with no return for the state and no guarantee that that's extra public property for us, that will lead to the prices coming down in the future. Just on the medical card itself now, and as I said, I welcome that it won't be taken into account. Interesting, 30.8% of the population have a medical card, which seems to be a significant proportion, but it's actually dropped. It's actually dropped 10 percentage points since 2012. At the same time, the GP visit card has increased, which is welcome. And then within that, for those who have a medical card, and this is something you're very familiar with, it's good that people have medical cards. It's good that we're progressing Sláinte care. But for those that have medical cards, repeatedly STDs were being told they're being charged for services, particularly blood tests. And so I have a reply there in relation to the blood tests that says they shouldn't be charged. But again, within that answer, there's room for discretion. And the Minister refers to various discussions he's had with the appropriate organisation in relation to whether there should be charges. Just today on Radio Nugweltachta, ní slúthia nniu le ceanteidil, hí duine I gcearán son muintir, cos muintir an talamh, go raibh na daoine sin ag teacht huige ag rá hí orm íoc as tostáil falla. Just in you, Shannon Cantedgel. So again, that's difficult. And finally, in relation to, I've mentioned it already, just the pharmacists, the monitoring, and the mental health, they're crucial for me. And it would be remiss of me, and I know Matthew McGrath has mentioned me standing up. All of this discussion has taken place within the context of a hospital in Galway that's constantly at breaking point. And I'm not saying that. This is the HIQA report. Just a year ago, and they attended Galway, and they said it was grossly overcrowded. At that stage, there was something in the 20s on trolleys. This week, we're up at 50-something. 60-something, 50-something, continuously overcrowded. The staff at their wits' end, but most importantly, no dignity, no privacy for the people, the patients on the ground. Progress was made in relation to diverting children from the accident and emergency. I understand that has slid back. So specifically in relation to HIQA, absence of staff, absence of consultants, with huge impacts. Not able to have a through flow because of a severe deficit. And I couldn't believe the figure in the deficit of beds, 220-something deficit in the beds. Not to mention that horrible word, two words, delayed discharges, which I won't use, but patients who are ready to leave the hospital, but they have nowhere to go. So all of those, and I'm only mentioning some, in the interest of brevity, I'm only mentioning some. At the same time, tá labbe followh I grílár na Gaeltachta in áras Vicdara an gadra rua. Lena blinta tá labbe followh I Fork Wirlanda. So while we have, with HIQA's report last year, and I understand it has got worse since, although they have employed more staff, more consultants, but they still haven't got their complement of staff. So at that, while there's pressure on the hospital, Merlin Park has empty beds in the unit there for elderly people. The Carrow has empty beds. And we get different answers about absence of staff. It's very, very difficult. And of course, we have the district hospital in Clifton, all of which could be used to take the pressure off the hospital. Finally, I'll finish on this to say, all of these problems were recognised years ago by various Taoiseach and various high politicians, including the Taoiseach, who said that the accident and emergency in Galway wasn't fit for purpose. We thought we were making progress with an options appraisal, which came down and said, build a brand new hospital in Merlin Park. I foolishly relaxed. And the next thing they came forward and did a second options appraisal because they said there was no answer from the government, and they decided on a lesser solution, to me a ridiculous solution, to extend the regional hospital, which is completely congested, and build an elective hospital in Merlin Park, which is now government policy. But the actual main recommendation of the 2019 report was to build a brand new hospital in Merlin Park. It unfortunately didn't happen. So Fáilte raibh an mBille seo is tús ma, is céim ma, ach maise de heile tar arás ó híomh cuasaí manatóireachta ó híomh na potagéirí de, gur an mBille magat.